Robin is the co-founder and CEO of Empassion. It's a new company focused on giving more good days to patients and families with advanced illness.
I think my superpower is I'm really good at putting pieces together and building systems. I also like puzzling, happen to be really good at puzzling, but I think it's along the same vein.
And then you thought, well, what the hell? The most complicated puzzle on the face of the earth, American healthcare system. Let me go and kind of try that. I really do worry about the unintended consequences for patients and families.
We have Medicare Advantage plans responsible for Medicare members from the second they become Medicare eligible all the way until their last most expensive, most vulnerable 6 months of life. Some people think this will get as high as 70%. If that's true, I don't think we can leave one of the most important benefits for a Medicare member outside the scope of those who are actually responsible for them.
Hospice is so difficult for people to choose at the right time because as human beings, the way I say it is kind of be funny, but it's not. Everybody wants to go to heaven. Nobody wants to die. It's that old song.
Hospice has to be approved by 2 physicians. It has to be medically necessary. It has to be something that a patient and a family wants to do.
So the interdisciplinary team model, so that holistic approach is built around time-intensive, keyword on time, psychosocial, spiritual care. So in a risk-based environment, what prevents the plans from pressuring providers to, you don't need that woo-woo stuff. That's actually what I've heard. You don't need that woo-woo stuff.
And so I think there may be some interesting advancements in these AI chatbots, whether it's text or phone, right, that sort of bring the cost of managing that relatively stable patient very low. And you say, great, I want to open the funnel of patients I would target for palliative care because now the cost to serve them is much lower. Why do we make patients go through that? And so how do we figure out a better path where it's not like hospice from day one is zero curative care, when some people may argue like getting dialysis is not curative. It's a symptom management, right? Like I should be able to keep getting that. So I think we need to figure out what's allowed during hospice in a better fashion, which probably also aligns to I should figure out how to pay hospice more appropriately.
Boy, people don't have tough conversations in their lives until they know that they're finite. And there's these beautiful outcomes that occur